The spectre of the H1N1 flu is haunting the world. As Zhang Yajing tells us, governments and organizations around the world are tightening precautionary measures against the spread of the flu.
So far, the World Health Organization has provided medicines worth some $2.4 million to 72 developing countries. And health ministers from Association of Southeast Asian Nations are scheduled to meet in Thailand on Friday to discuss the flu outbreak. Meanwhile, the Asian Development Bank says it will provide financial support for Asian countries heavily affected by the pandemic. And South Korea is stepping up precautionary efforts by restricting travel to Mexico. Passengers arriving at the airport are required to go through temperature examinations. Anyone whose body temperature exceeds 38 degrees Celsius will be given a more detailed examination, and those who show a positive result will be quarantined. The Public Health Agency of Canada is advising healthy people not to wear surgical masks. That's because there is no evidence they prevent the spread of the virus. In Zambia, officials have imposed a ban on the import of live pigs and pork products from seriously affected countries. The government has also published a preliminary fact sheet on the virus strain. And in Nicaragua, authorities have decided to freeze all prices of flu medicines and sanitary materials for 60 days. Zhang Yajing, CCTV.
China's health ministry has offered a clear definition of the H1N1 virus, which originated in Mexico and has spread around the world. The current cases involve the H1N1 strain of the type A influenza virus. It is a mixture of human, pig and bird strains and is different from previous influenza viruses. It can be transmitted from person to person, and the incubation period is between 1 day and a week, which is longer than seasonal flu or bird flu. The early symptoms of H1N1 flu are similar to those of seasonal flu and include fever, coughing, sore throat, fatigue, headache, and also it could involve vomiting, diarrhea and red eyes. Other symptoms, the effects of the H1N1 virus can develop quickly, with some patients experiencing high fever, serious pneumonia, pulmonary hemorrhage, renal failure and Reye syndrome. These can lead to death. The number of confirmed H1N1 flu cases around the world continues to rise. The World Health Organization has said that 16 countries and regions have now reported confirmed cases of the strain. It said Mexico has confirmed 16 deaths due to H1N1 flu in the country, among the 397 people there confirmed to be infected. While the Mexican government said 19 people have died, with the infected number of 473. The US has reported 160 confirmed cases with 1 death. Italy, Ireland and Costa Rica confirmed their first flu cases Saturday. The World Health Organization has released 9 consecutive newsreels on the influenza H1N1 virus. That's after the WHO confirmed for the first time that human beings had been found infected with the flu virus in Mexico a week ago. However, the figures of deaths or confirmed cases provided by the WHO are often lower than those issued by various countries. Our reporter Zheng Sui finds out why.
In its 9th newsreel, the WHO says by 6 GMT on Saturday, May the 2nd, there were 17 deaths caused by the H1N1 influenza around the world, and also that there were 615 confirmed cases. The WHO reported that Mexico had 16 deaths and 397 confirmed cases. However, as early as a week ago, Mexican health authorities reported that 103 people were confirmed or suspected to have died of the virus in the country, along with 1,614 suspected cases. The WHO has explained the differences relating to these figures. The World Health Organization says it requires necessary confirmation for the figures reported by countries and regions, and that the WHO does not provide final figures until verification by strict standards based on international health regulations. The document requires that the countries report public health incidents to the WHO, and then the World Health Organization must check and confirm the incidents reported by countries and quickly carry out risk assessments with the countries and regions. Therefore, WHO figures may initially be lower than sources from various countries and regions because some cases are still in the process of being checked and confirmed, or suspected cases may have been excluded after clearing the strict checking process. As it always does, the WHO has clearly stated the development of influenza H1N1 in each newsreel based on the international health regulations. Comparing the newsreels over the past few days, experts say it is clear that the World Health Organization has given vigilant attention and cautious consideration to the current flu virus, as well as its possible economic and social impact. Zheng Sui, CCTV.
4 authoritative international organizations have issued a joint statement saying pork products handled in accordance with hygienic practices are not a source of the H1N1 infection. The 4 parties making the statement are the UN Food and Agriculture Organization, the World Health Organization, the World Organization for Animal Health, and the World Trade Organization. The statement also underlined the importance of collaboration between veterinary authorities and human health counterparts to monitor pig herds for any signs of unusual illness, especially for any H1N1 virus-related symptoms.